It's been the year of AI, right? Artificial intelligence. Companies are using it to design cars, even lower electric bills.
And now AI is helping out at the pharmacy. Let's talk about it this morning with Samm Anderegg, a pharmacy market expert and CEO of DocStation. Good morning. Welcome to Houston's Morning Show.
Good morning. Thanks for having me.
Well, tell us how AI is helping pharmacists.
So like in every industry, AI has the potential to automate a majority of the repetitive, menial, administrative tasks that consume hours of most of our workdays. So what we're trying to do is allow it to focus on what matters most, the things that we're best suited to do. And for pharmacists, that means spending time with patients. I think the pandemic really showed us how critical pharmacists are to the public health infrastructure in the United States.
Oh, for sure.
And with 9 out of every 10 Americans living within 5 miles of a pharmacy, we want to use these recent developments in technology to get pharmacists out from behind the counter and engaging with patients face-to-face as much as possible.
Okay, so could this cut down on medication errors, or do you think that this makes things more, error-prone?
I think it actually could cut down on medication errors. So I'll give you one example. So at DocStation, we're using AI paired with prescription refill history. So we can tell when patients start missing doses of critical medications, and we can surface that information to your pharmacist so they can reach out and engage with you and just see what's going on before it leads to some sort of adverse event.
So it sounds like it's keeping a closer eye on medical records for one. And then we understand that the stats are showing that this could reduce administrative duties by 80%. So if pharmacists are using AI, that just means the pharmacists have more one-on-one time with their customers and the patients?
Yeah, exactly right. I think the most important work that we're doing right now is we're helping pharmacists actually get paid for services they provide and the time that they spend with patients. So our whole goal is to transform pharmacies into primary care clinics. And as you can imagine, pharmacies aren't set up to bill insurance companies for an outpatient visit or a lab draw like your doctor's office is primarily. So we're using AI to automate several steps of that process to make it really easy and simple for pharmacists to get set up and start earning revenue and money for taking care of patients. And so that's how we're trying to change the model.
Are you seeing this actually in a lot of pharmacies yet, or is this going to be rolling out later this year, or what's the time frame on this?
Well, I think you're seeing pharmacies, like I'm sure many of your viewers, using AI just for personal use with things like ChatGPT. But it also comes down to the companies that are helping pharmacies and any healthcare provider really leverage AI for their practice. And so I think you're going to start to see the use of some of these tools and some of the workflows and processes within the pharmacy. And I think eventually it's going to lead to just an incredibly different experience for patients at the pharmacy.
So will we know that's happening at our favorite pharmacy when we get to spend more time with the pharmacist, or will it be fairly obvious, or is this more all behind the scenes happening with AI?
Yeah, I don't think it's going to happen overnight. I think it's going to happen over time. What you'll see is your pharmacist engage with you in a different way and start asking you different questions about your healthcare journey. And for patients, it's just a great benefit, right? You've got another accessible healthcare provider there that you can talk to and help you manage your healthcare journey. So we're really excited for the future.
I know my pharmacy has long lines all the time, and I know a lot of you are the same, so it can only be a positive, I think. All right, Sam, thank you for joining us here on Houston's Morning Show.
Thanks for having me.